Uh, Whose screen is on? Whose screen is there?
When she have you joined?
I am. I am. I have joined.
You're muted though.
How do I make people can hear me? No, I'm saying how do I I'm meeting myself.
Give me. Well, you're not unmuted.
I am unmuted.
Nobody's muting
So
you.
you're not
muted, rather.
Now I'm not.
Yeah,
It was
you're
before. What kind Hello everyone, good afternoon. You are cordially welcome to the Sydani Group Digital Health webinar. We are so excited and happy to have you on here. We're going to wait briefly for other persons to join. So this is a good time to share the link with your network, tell everyone that we are starting this amazing and very insightful webinar. Whilst you're here, please go ahead to introduce yourself in the comment section. Let us know your name, your organization, and what country you're joining in from. It is set to be a very engaging and exciting time, and I can't wait to moderate and lead you through this event. So we'll be starting shortly while we let other guests join in. Thank you. Hello everyone, you're welcome. Thanks again for joining. We just noticed that the chat's not disabled for participants yet, but we're fixing that and we'll be starting shortly. So thank you very much for once again for joining. We can't wait to kickstart this conversation. So do well to share the link with your network, and we'll be starting at exactly 3:08 with the welcome address from Sydani Group. Thank you very much. All right, so we are going to kickstart our webinar. Thanks to everyone who has joined. Sorry for the little technical glitches we have had to come to. My name is Dr. Joy Aikowakan, and I'm happy to be the host of this all-important digital health webinar organized by Sydani Group. The goal of this webinar is to, one, kickstart conversations around digital health, its implementation in Africa, but more importantly, to discuss the topical issue of moving digital health ideas and from pilots to scalable public health solutions. We are going, this event is going to be in two major segments. Firstly, we are going to talk through and learn more about this amazing organization that has organized this all-important event. And then we're going to delve deep into some of the digital health portfolio and projects and products that they have developed over time. And then to the very interesting and engaging part of this conversation, where we're going to be having a panel session with amazing speakers from across Africa who are going to delve deep into the topic, expanding the horizon of digital health from pilot to public system scale. So I mean, get your notepads, tell your friend to tell your friend to tell your friend that we have started, and we're going to be kickstarting this event with a welcome address from Mr. Sunday Atobatele. I will take his profile briefly, and then we'll welcome him to give the open address. So Mr. Sunday Atobatele is a partner at Sydani Group, where he serves as a management consultant and public health specialist, driving strategic leadership across health, education, agriculture, and renewable energy sector. He leads initiatives designed to strengthen systems, build human capital, and advance equitable development. And he is instrumental in nurturing future African leaders through his role as the principal and director of the Sydani Fellowship Program. As an accomplished researcher and thought leader, he has co-authored numerous peer-reviewed publications focusing on public health and system integration. So with virtual claps, let us welcome Mr. Sunday Atobatele for the welcome address. Over to you, sir.
Good afternoon. Good afternoon, Joy, and good afternoon, everyone. It is a real pleasure to welcome you all to today's webinar on digital health from pilot to public system scale. We've chosen this topic at this point because as governments and partners are shifting focus from innovation to institutionalization, it's very important that digital health solutions are looked upon from the angle of how can they be embedded and institutionalized within national systems. So that way, the focus is no longer on siloed pilots and achieving results from piloted solutions to looking at how some of the solutions can be embedded within public institutions and how they can be sustainable. And digital health, of course, continues to play an important role in strengthening health systems, improving access to care, and supporting better health outcomes. So for today's session, we'll be looking at the opportunity to learn, share experiences, gain practical insights from experts in the field, some of which have been lined up to be part of the panelists, as well as highlight the progress that we have made as an organization in the digital health space. Over the past decade, we have witnessed a rapid expansion of digital health solutions. And we're hoping that during today's session, we're able to not just share lessons from what we've implemented, but also learn from partners, government stakeholders across the continents that will be joining this call. So for today, we are excited to have you all here, and we look forward to having an engaging and insightful session. So thank you very much once again for joining, and I will hand over back to Dr. Joy to facilitate the session. Thank you.
Thank you very much, staff, for that welcome. Thank you very much, staff, for that. We really appreciate you. Next up, we are going to be moving into talking about Sydani Group. I know so many people here are curious. What is organization? We've seen so many pictures and posts and content around social media, and we want to learn more about this organization. So I have the privilege of inviting again Mr. Kolade Jimo, who would walk us through about Sydani and also our digital health profile. So Kolade Sydani is an associate principal at Sydani Group. He's a global health leader and development strategist and has worked to develop impact across health systems and health capital in low and middle income countries. He's an accomplished public health management consultant with expertise in managing multi-million-dollar projects within the health sector across multiple stakeholders and organizational boundaries, and has collaborated with international donors, including BMGF, USA, Gavi, US CDC, World Bank, and AHFID. So again, with virtual claps, let us welcome Mr. Kolade Jimo for the next segment of our webinar.
Thank you so much, Dr. Joy. And again, it's a very great privilege to be here and to also witness this this webinar taking shape and coming to life. As an organization, Sydani is a group of companies where we have different subsidiaries, but across all the subsidiaries, we are driven by a vision of setting new standards of excellence in creating solutions to complex challenges and international development across education, health, agriculture, human capital development, climate change, technology, amongst others. And we do this by helping our clients and the people we serve to develop strategies, to forge partnerships, and develop technologies. I mean, today we'll be talking about digital innovation. And you can't talk about digital innovation without talking about technology. So we are also driven by the desire to deploy technologies and also talents that help to strengthen the performance and deliver sustainable advancement within the health and social development space. And as we do this, we're driven by core values. One of it is innovation. Innovation in the sense of pushing boundaries towards maintaining or challenging the status quo and constantly evolving and using ideas that helps to deliver solutions to our clients and the people we serve. And while we do this, we are very heavy on impact. How do we ensure that just beyond doing the work, we're able to deliver sustainable solutions that improve the lives and livelihood of the people that we serve? So we're not just focused around developing reports. It's about how do we translate the actions and solutions that we have to measurable and sustainable outcome. And also we deliver quality. So which is, if it's not to the best standard, then we don't go in looking for it. So we ensure that our work are delivered to the best of our ability and to the best that it can, to the best way it can serve the people. And while we also do this, we are very heavy on integrity. We uphold the high standard of professionalism, confidentiality, objectivity, and without any form of compromise. And while doing all of this, we ensure that our solutions are long-term, sustainable, stay with the people, remain with them. I think this also aligned with the focus of today. How do we transition from just pilot to something that is sustainable? And this is part of what has driven this initiative. How do we ensure that just beyond our organization, we understand how solutions move from pilots to being sustainable generally? And in terms of our focus area, we operate, as I've mentioned, we support initiatives across the health sector, climate change, education, human capital development, agriculture, and energy. And in terms of our footprints, in terms of how we deliver our solution or expertise, we support across all these sectors. In terms of strategy design, we have products, some of which are digital that I'll be speaking to today. We also lead and support capacity building rather. How do we strengthen the capacity of the people we serve and we work with so that the initiatives we've developed to remain with them and is able to, it helps them to remain resilient. We also support around data management, building data management system, using it to also track performance and ensure that beyond just the activities and the initiatives, we have a result to show for it. And we also support initiatives around financial modeling, assessment, demand generation, commodity supply chain, and also implementation and operational research. In terms of our footprint, we are headquartered here in Nigeria. We have our office in Kenya, in Nepal, and also in Sierra Leone. And we also have footprint spread across different parts of the world in terms of the projects that we have implemented. So thank you. I hope that this, okay, and now we've not been doing this alone. We've been doing this in very close collaboration with our partners, both from the government side and also donor agencies and other development partners, some of which are mentioned here. This is broader than this. And we make proud to say that from the early stage of being a small organization, we have grown to expand to a very large team spread across different parts of the world, delivering sustainable solutions and ensuring that we continue to redefine excellence consistently. Thank you, and I hope that this provides some, this gives some introduction to who we are as an organization, and I look forward to also speaking to also, getting our thoughts around how to advance the discussion around the digital space. Now, going into our digital portfolio and some of the work we've done, I'll be speaking some of our digital solution, and just to mention that the drive towards building a digital portfolio is to ensure that we are able to build a resilient system that is sustainable. And we know that within the low and medium income countries, one of the things that we've seen is that we still struggle with a lot of things around innovation and how do we transition from the way we used to do things to like aligning with the best practices, especially when it comes to digital solution. So for us, in terms of our contribution to this, we have some of our digital health solution. One of which is the micro coverage tracking tool. Another one is a partner resource mapping tool or the resource tracker, the digital accountability framework that we supported the government of Nepal with after a successful implementation in Nigeria, the VAC Insight, the listening for impact tool, the Basic Care Provision Fund monitoring, learning and evaluation platform, and the wristband for immunization alert. Now, going into details around what these different digital health solutions, what do they do and what have we achieved with them? So the micro COVID tracking tool is a geospatial solution that we've used to profile communities, also then track data at the hyperlocal level. And what this helps to do is it helps with effective planning. I'm sure many of us will agree with me that within the health space, one of the things we struggle with is the problem of denominator. It's quite difficult to get an actual number of people that we have at a certain point due to the spread and the different geographical archetypes that we have in the country. Now, what we've done is to introduce a geospatial solution that helps to map people across different locations. It provides a geospatial view of the composition, the distribution of the people across different communities. And in terms of the use case, we use this in identifying zero dose and underimmunized children. I mean, those are children that they've not taken one of the tracer vaccines which is the pentavalent vaccine. And what we're able to achieve with this was that we're able to do community profiling. From this, we were able to identify communities and households that ordinarily were missed out. Nobody even know where they are. So we're able to use that using GIS solutions to identify them, to map them, and sort of track the performance across this area. And also we then use this to deploy targeted service delivery, where who are the people, the people, to what extent have they accessing healthcare services? Where do we have the gaps? How do we ensure that they are integrated into our planning and ensure that everybody is covered and captured? So this shows the flow of the micro COVID tracking tool. So it has different components. The data collection bits, where we have field officers go out to collect data at the local level. collect data from the people. It's GIS enabled. It has a geofencing component where you can't collect data beyond the area where you've been deployed. And also has some data quality checks. So we have the data collection tool that is able to map and collect data across different areas where this tool is deployed. Next to it is the component of the tool that then also, please, if you can move to the next slide. Yes, as I mentioned, the data collection tool that our field officer we can use deploying field officers. That's geofencing component that is able to ensure that people collect data within the area where they've been deployed. It functions offline, so it takes out the aspect of people being worried around, can this be used in area where there's no internet and all of that, because we understand the peculiarity of some of the outreach and difficult area in Nigeria. So this is built with that in mind. And of course, that's GPS routing, where similar to what we do using Google Map, that it takes you to the exact location that you're going. And it also has a function of intelligent validation. So data that is collected is auto-validated to avoid any form of data falsification. And of course, it has a dashboard that does some analytics, does a visualization, run auto analysis and visualize performance. And it has interactive maps that can be downloaded. You can see it. You can narrow down to where the people are, and you can also generate heat maps, do some layer toggling all around, and also track performance, as the case may be. Another component of this is the visualization component of this. So one of the things you have on the micro coverage tracking tool is the module on the demography. As I mentioned, it shows the people, the household, the number of people within the household, the distribution of the people in terms of their social demographics, the gender, the age, and a number of other things, which provides a lot of robust database for planning, even beyond the health system. How do we ensure that resources get to the right people? And how do we ensure that resource optimization is also achieved? And beyond that, from the use case of where within the health space, we've used this to track program coverage. In terms of the number of children that have been vaccinated, where do we have the gap, which villages have not been reached, and it enables that level of granular visualization and tracking in that sense. One of the other modules that we have where we've used this is also tracking human resources availability within the airspace and also surveillance data. For those of us in the airspace, we hear of recent, there are cases of diphtheria outbreak and a number of other outbreaks. But one of the issues is, why wait till the outbreak happens? Why not even track different cases that are happening at different places, suspected cases that could have been investigated earlier, do some proper monitoring, confirm the non-true cases. Those are the robust system that this platform has offered. In addition to also helping to plan what are the resources that are also even required to ensure optimal vaccination coverage, from the cold chain equipment angle to the vaccine that are required, which one is supplied, what kinds of vaccine has been utilized, do we need to redistribute vaccines to other places? So this is how we've been able to deploy this and use it to solve critical problem within the immunization space, and currently helping the government to institutionalize this. And of course, at a very broad level of achievement, we from our mapping, we've been able to enumerate, and this is just in Niger State, one of the states where we deployed this, enumerate over 300,000 households that have been enumerated. And what we saw was that this was able to show a gap in the estimate that the government had before, and 6% estimate. 6% might look sort of insignificant in terms of the percentage, but I'm talking about thousands of households that were missed and were not included in planning. We also use this to do using the smart routing to vaccinate children that before now were not vaccinated, were not reached, and improve coverage. And of course, develop a digital micro plan that is used for planning and offers a robust source of data for their facility to do integrated vaccination, determine the distance to the air facility, from their facility to communities. And also, it also has this dashboard where you can just be in your office, see what the performance and the coverage has been, and where effort needs to be focused. Moving very quickly is to speak about our resource tracker. One interesting about Nigeria is that even when we complain about inadequate resources, you realize that resources are bound in some areas. Even at individual level, some people are living in riches while some people are living in penury. So how do we map in terms of planning at the policy level where the resources are available and where do we have shortage of resources so that it can help both the government, individuals, and corporate organizations repurpose resources and have better planning. And this is what the resource tracker has done. We deployed this in Niger State where we looked at partners supporting health services and where do we have the resources concentrated, where do we have suboptimal resources, where can we even integrate as partners that are supporting the health system across different health pillars. And that's what we've been able to achieve with this. I'm happy to mention that through the deployment of these resources, we were able to better optimize resource allocation within the state, and this helped to guide targeted resource allocation even beyond the health system. And of course, right now, what we've been able to also do is layer the two solutions of the micro-COVID tracking tool, which identify where people are. With the resource tracker, we then looked at what resources are available within the different area. And that was able to help us determine the available assets and also reallocate resources from where they're in abundance or the resources are oversaturated. Aspect of how do we ensure that as we deploy resources, our government made lots of commitments, we have things that we're using we have indicators, measurable ones, that we're using to, determine how well we are performing and what are the gaps that exist. So if we can move to the next slide, please. What gap exists? So we were able to help the government of Nepal. So moving our support to beyond the African region to Asia. So how do we ensure that within the governance structure, financing and budgeting, how do we ensure that we're able to visualize and track performance around the resources that are available and how government is committing to different things? One of our solutions is also the VAC Insight. The VAC Insight offers an interoperable system where we are able to overlay service delivery data with logistic data and other, so that for healthcare workers at the health facility level, they are able to just within one click make informed decision around how to optimize resource allocation. Dr. Joy, I'll be wrapping up very soon. Yeah, so that's one solution that we're very proud of, given how well it's been able to help the healthcare workers improve visibility of data and interoperate data from DHIS2 and OpenLMIs. And for the listening for impact, for those of us that are also within that space, we know that lots of resources go into demand generation. How do we change the behavior of people? We deploy jingles, we do lots of campaigns, but is there a data management system that track to what extent are we able to track the contribution of different initiatives to social and behavioral changes? And that's something we're able to achieve, one of its kind in the country, where we develop a robust data management system for demand generation, tracking how well, the initiative on demand generation is able to translate to improved change in behavior around complacency, confidence, and complacency and confidence. Also, within the Basic Care Provision Fund, we developed a platform that is able to change the narrative around how the service utilization is tracked. Before now, within these states where we deploy this, what they do is data around service utilization is collected at a facility at paper level, sent to the LGA, then sent to the state. And you can imagine when data transmission takes that long, the question is, how do we even use it to make informed decisions? So we're able to develop an application, mobile application and a dashboard. So the mobile application is used to collect data, which synchronizes into the dashboard, and it helps with effective decision making. And lastly, the digital innovation tool I'll be talking about is the wristband for immunization alert. And that is really helping to solve the problem around access for people in the hard-to-reach and difficult terrain. We know that within this area, some of our people have limited limited knowledge around health. They have the limited seeking behavior and also knowledge around the health services. So for immunization, we're able to use this ribbon alert to set a reminder for them on when they should go for vaccination. So it just beeps, it's set, so it beeps and remind them when they're meant to go for vaccination. Very simple to wear wristband, and it has really helped to change the narrative around, reminders and behavioral change for our people. Thank you so much. I think this is where I will just wrap it up. But on the digital health portfolio, so just to also mention that as an organization, we are very keen on partnership because, again, it's not just around deployment of the tool. How do we institutionalize it? How do we ensure that it goes beyond the deployment within one region, but extends to other regions? So we're happy to see how across different components, we are able to strengthen a partnership for the deployment of this initiative around different areas, and also consolidate it with the other digital health solutions or digital solutions that are bound within the space. Thank you so much. It's been a very great one speaking to us about this. Thank you, and over.
Thank you so much, Mr. Akolade. That was amazing. And even I, knowing some of the digital health tools at Sydani, was just really amazing listening to it over and over again. More importantly, the impact that these tools are able to create. We have some questions already from that presentation, but because we are running a bit short of time, I'll take one of those questions. We have a dedicated question and answer session at the end of this, where we will attend to all of the questions, but I'll just take one of these questions and we'll move directly into the panel session. So Mr. Akolade, the question I have here is concerning the MCTT tool. So one of the participants is asking about any key challenges that Sydani has experienced in the implementation and usage of the MCT tool, and also if Sydani has plans of, diversifying this tool to be able to be used by other states aside the current implementing states.
Thank you so much. Very profound question. In terms of the challenges, of course, digital solution is not without its challenges. So when we talk about it, it's not to say that we've not also experienced some challenges. So the most fundamental challenge we've experienced is around the digital maturity of some of the areas where we worked. As you're aware that within the remote and artery settlements in Nigeria, network access and the level of knowledge people have about digital solution is very limited. So that was a fundamental problem. And how we solve that is the tool is both the tool and the dashboard, they're developed to be compatible with even the simplest form of Android devices that people use. And at the same time, the tool has offline functionality where it can work offline and people can just synchronize the data, afterwards. So that's one of the fundamental challenges, and that's really, helped us to build a system that enables the people to use it regardless of their level of, digital maturity in that sense. In terms of it being scaled, yes, definitely. We are happy to see how this will translate to more impact across different geographies, not just in Nigeria, but other countries. So that's something that we're definitely exploring, and we're open to different form of partnership that can advance this. But yes, thank you so much, Dr. Joy. Over.
All right, thank you very much. We'll take the other questions during the general question and answer session. I believe we're already having a very engaging and exciting time. I am, and I hope you are. If you are just joining, welcome again to the Sydani Group Digital Health webinar. And it has been a very insightful time so far, where we have got to learn more about Sydani Group as a hosting organization and also its digital health portfolio. We have gone through some projects and, more importantly, products. A key part or a key goal for us and objective of this webinar is not just to talk about the work that we do, but to ensure that we have key stakeholders in one room where we are able to come together to collaborate to not only implement these tools, but see how we can move them from single state implementation to national and even global implementation. So this is a good time to begin to connect. In the comment section, introduce yourself, what organization you are coming from, what country you're joining us from, but more importantly, one key thing you are looking forward to learning during this webinar. So very quickly, we'll be running into the panel session. I am very excited about this session, simply because I get to speak with people who I admire and respect in the digital health industry, but more importantly, we are going to talk about a very topical and critical topic. So I would quickly run through the profile of our panelists, and then we'll get straight into the questions. So first panelist is Mr. Innocent Chiboma. Apologies if I do not pronounce some names correctly. I'm happy to learn them after this webinar. So he serves as the Principal ICT Officer, Digital Health, Ministry of Health, Zambia. He has supported the development of Zambia's 2022 to 2026 digital health strategy and the health data governance framework, recognition of the Digital Health Technical Working Group, and its current leading efforts to develop Zambia's National Health Intelligence Center. He played a key and pivotal role in implementing the National Electronic Record, Smart Care, the Laboratory Information System, DISA Lab, and also the Electronic Logical Information System. He serves as an international consultant with the WHO and other global organizations. So please, with our virtual claps again, feel free to unmute your mic to clap for this. Please let us welcome Mr. Innocent as one of our panelists today. Next panelist is Darlington Akogo. He is the founder and CEO of minoHealth AI Labs, Akogo, Rumila AI Institute. Mr. Darlington has been named as one of the Forbes 30 under 30 and featured on the cover of Forbes as one of the global top 100 most influential people of African descent in healthcare. He serves as the chair and top driver of the top group on the UN GI AI for Health, as well as the chair for the working group on artificial intelligence economy, working towards development of continental strategy at the African Union. He also serves as the global innovation advisor to the International Development Innovation Alliance. Please let's put our hands together and welcome Mr. Darlington as one of our panelists. Next on our panelist list is Dr. Kemi Bolarinwa. She is the founder, MedTech founder and innovator and CEO of Nextwear Technologies. She's passionate about robotics, embedded system engineering with 13 years of experience and exceptional tech skills and strong problem-solving skills. Her work focuses on expanding access to accessible and affordable healthcare solutions globally. She's the founder of Nextwear Technology, the first wearable technology startup in Nigeria that designs and develops technology, one close to the body, to solve health-related challenges. She also serves as the president of the Women in ICT Foundation, a nonprofit that focuses on providing technology education, leadership, and businesses for women and young girls. Please let's put our hands together for Dr. Kemi. Lastly, on our panel, last but not the least, we have Mr. Babatunde. He serves as a senior director and AG country portfolio lead for the Africa Hub for Innovation and Development. He has over 15 years of experience leading health innovation and developmental initiatives across Africa. He's an expert at portfolio management, including strategy development, health system strengthening, and scaling impactful digital health projects. He has managed multi-million-dollar digital health programs in Nigeria, Ghana, Ethiopia, and Africa. Please let's put our hands together for Mr. Babatunde. You see that we have a very packed panel session, and I can't wait for us to delve deep into the questions we have today. So I would ask at this point for all our panelists to quickly turn on their videos and unmute their mics so that so we are at the top of the screen and our viewers and audience can see us. Beautiful. I can see Mr. Innocent. Thank you so much for joining us. I can see Mr. Darlington. Thank you so much for joining us. I can see Mr. Babatunde.
Thank you.
So can you please confirm that you can see us? It'd be great for you.
Yes, I'm here.
All right.
Yeah.
Please I would like the audience to also confirm if all of the speakers can just say a hello so that we confirm that the audience can hear us, and then we'll kickstart our conversation.
Hello.
All right, great. So my first question is going to go to Mr. Darlington. Very interesting portfolio, and I feel like the elephant in the room when we have digital health conversations, or where everybody's mind is at currently, is artificial intelligence. And we have successfully served as the CEO and founder of multiple artificial intelligence focused organizations, and also at a global or continental level with African Union. The big question on the table is that Africa currently has of unemployment, power, really access to health that currently people living in Africa currently face. How are we able to, one, push for the adoption of AI-focused tools, but more importantly, who is bearing the brunt of implementing this tool and ensuring that they are used by people in Africa?
Okay, thank you for having me. Good afternoon, morning, evening, depending on where the different audience members are. Happy to be here. Yeah, so that's a very good question. So essentially at minoHealth AI Labs, that's the question and the challenge we address. Without a doubt, AI is probably the most advanced, the most consequential technology that humanity has created. And healthcare arguably is also the most important delivery sector in the world, right? Because other sectors are important, but when it comes to healthcare, it's about our lives. And so picking the most consequential technology and bringing it into healthcare, and even taking it a step further, deploying it in, say, the global south, where we have some of the most complex health challenges, is extremely important. And so there's different challenges you encounter that you mentioned, but I don't think, especially in the year 2026, those challenges are not overcomable. To some degree, we've overcome a number of them. Our AI system at this point is being used in over 50 countries, maybe somewhere like 80 countries around the world. We have Africa, North, South America, Asia, Europe. And there's different things you have to do. You need to start in stages. First of all, are you deploying to patient directly? Those have technical challenges. They have medical challenges. They have medical legal challenges. You need to address them. Are you deploying to doctors? If that's the case, are you deploying as a medical decision support? So you need to balance everything between healthcare, technology, the science of AI, and a legal framework so that you're in compliance. And so with the years of time that we spent doing research, doing development, but also working with regulatory agencies, we've been able to balance that. It's not impossible, but it's also not an easy task at all. You can't build something and just throw it out there. You might be breaking several laws. You might be breaking data protection laws. You might be breaking laws with regards to FDA in one country. And even if you move from what you're doing, say in Ghana, and you take it to Nigeria, it's a different regulatory environment. You need to comply with that. So you need a strong understanding of all of these things and balance it out. Then you also need to look at, if you're deploying your technology and needs to end up in rural facilities, how do you make your technology very lightweight? Because you don't expect people in rural areas to be loading up terabytes worth of tech source code. So all of this are problems that you can solve. It's not easy, but it's worth working on. So that's what we do at minoHealth AI Labs.
All right. Thank you very much for that. I think the key takeaway from that is contextualization of our solution, to realize that one solution does not work for every climate, and then we contextualize it to the communities that we are trying to reach. So thank you very much. You've mentioned something that we're going to come back to very briefly. So my next question will be to Mr. Innocent. So you come from a very interesting perspective, which is the government part of things. And in Africa, as ambitious as we want to be, governmental goodwill is a major part of the success of every pilot, of every idea. And Zambia has successfully implemented over 3 digital health focus tools, which I mentioned briefly. So we have Smart Care, we have the DISA Lab, we have the ELMIS. So quickly, I want you to just briefly talk us through, one of those tools, but more importantly, the implementation of those tools and what is the current climate in the implementation of those tools. So are they being adopted on a national scale? Are they being used in hospitals and fertility? And what is the reception like in terms of healthcare users who are using these tools and also the patients who are benefiting from those tools?
Thank you very much. So yes, we have deployed what you would say at national scale, the electronic health record system, which is the Smart Care. We've gone to about 2,000 of our health facilities out of 3,500 or so. We have also deployed the electronic logistics management information system to about 1,600 sites, and the lab information system to most of the major labs in the public sector. And so I don't think it's everyone here can agree with me when you talk about digital health. It's not an easy thing. It's not like you're just deploying an app or installing a word processor on a computer and you leave. It is a whole arena that requires, in fact, probably the biggest part of the work is not on the tech side, but mostly on the human side. That's number one, acceptance from leaders at health facilities. Number two, acceptance from the users themselves. Number three, acceptance or adoption of the system by the clients or the patients, and then also the community at large, because that has an impact on whether that system is going to succeed in that environment. So we have been at it since about 2004. So over 20 years deploying and working on the electronic health record system. And with our latest version called Smart Care Pro, a centralized web-based system, we've gone to over 2,000 facilities. And it hasn't been an easy task to get acceptance, because there are various reasons why people would resist technology. One of them is fear. One of them is the fact that they will think that, okay, I think now they'll know what I'm doing. The other one is just the ability to utilize. People don't want to show that they're ignorant, so they would rather resist it than say that, look, I don't know how to use this thing. And then also rumors. People hear a lot of rumors about information technology from other places and from other users, and they want to say, hey, we don't want to do this because it's going to A, B, C, D. But we have found that some of our worst critics or the worst resistors, after they get introduced and after they get converted, become our biggest champions in those health facilities across the country.
All right. Thank you very much for that. And that's a very interesting perspective, because with the implementation of health comes a lot of resilience, especially with Africans. So we have to try again and then try again, and just really watch that cycle of change management happen. But thank you very much. Amazing work that Zambia is doing. And I hope that this even serves as a challenge for key stakeholders from other countries to see that. I mean, this is 2024. I mean, several years of building and just really keeping at it and ensuring that we achieve the goals that we have set to achieve. Thank you very much for that, sir. My next question is Dr. Kemi, my fellow female on this panel. And very interesting perspective that you bring to this panel, in the sense that we are all conversant with software, digital tools and digital policies and innovation. But you come from the perspective of hardware tools, but hardware implementation, and from the diagnostic point of view. A major challenge for hardware innovators across Africa has been having a great idea, taking it to some level of pilot, but because there's a problem of funding but more donor dependent, most of these tools are not able to scale. What we have seen, Nextwear and the work that you do with, I don't want to pronounce it wrong, but EWA-DX, that's it, scaling aside a pilot. So the question I think most people have here is, how did we do it? How were you able to do it? But realistically, how are hardware innovators in Africa able to move from ideation stage to ensure that they are able to scale nationally?
All right, thank you. I'm Dr. Joy. It's a pleasure to be here. And pardon me, I'm not a doctor, not a medical doctor or an academia. I'm Kemisola. Well, I studied electrical electronics, then now working in robotics and embedded C. So thank you once again. I'm so happy that you've already, broke down the question. It's a general thing. It's a general perspective that hardware, which is the truth. Hardware is a major challenge. When you're working in hardware, is a major challenge in Africa. For you to strive, starting from your R&D to you, coming up with pilot or even scaling. The scaling just put that. Let's just spend that. The majority of this thing just end up at the R&D stage. So it's a big challenge, and which we face while we're developing our own solution. Basically, we work in MedTech space. We develop medical technology devices in form of wearables now to help with early detection of diseases. So instead of us as Africa, looking forward to buy $1 million of equipment, maybe a scanner device, a scanning machine, which is like, the truth is we don't have the facility, we don't have enough resources for that, for this machines to go around. We have them in few places. So what we do is to try and see how we can make it affordable for government or hospitals to own one, bringing it down to a very compatible form and perform that same function, actually. So that is what we're doing. That's a problem we're solving. So coming to how we're able to sustain that, though it has been a big challenge working in the hardware space. And aside that, as a female working in that space, it's sort of ethic, starting from the ideation side, we have fantastic ideas. Africa, we're so blessed because I put up a platform where I call Nigeria Innovative Hardware Society, where I see these young minds coming up with hardware solution in health, not just health alone, in every aspect. But the problem is, not scaling, I would say scaling, even achieving the development. Fine, they've done research, but how about developing it? Some of them develop with what they have and they later get themselves stuck after spending a lot of money to put those things together. So this is a problem which we also face. And in fact, that what actually took us out of the country. When we see that we can survive this, we are not in a good enabling environment for what we do. We are the first to do that in Nigeria. So not in a good enabling environment, like I said, there's the funding to support the research materials, having the right human power to do all those things are what actually pushed us out of the country. So it's a big challenge, and I'm sure the reality is some of these hardware developers are facing the same thing, not just in health, in every other sectors, trying to build up solution. They're also facing these challenges. So for us, we felt, okay, this is what we are building is a global solution. Breast cancer is a global problem, so it's not really pertaining to Africa alone. So for us to be able to make sure that those products come to life, because we actually, the old dream, the old idea of the solution came through my experience in Africa, as an African lady and as a woman, around here, So I believe, okay, we were able to step out. Let's get more hands, more support to get this product out. So by the time we build it, we come back to Africa and deploy it, because that's the whole aim. It's not really about when I started. It's not about monetizing. It's about solving the problem, because the problem was, it's a personal thing to me. I was affected with the problem. So that was why I took it upon myself to look for a solution for it. So it has been a big challenge, like I said, and we are hoping the soonest something will be done We don't know when. I think the people in charge, they know how, but well, it's fine. Let's see how it's going to be. But from our own ends, we have to, look for a way how, because we've like, okay, we can sustain this. If we really want this company to grow, we really want the solution to be out there, then we have to look for an alternative.
Thank you very much for that. And I think that's very interesting. So get people who can fund our ideas and make sure that those ideas are now helping the African communities to win-win solution. My next question will be to Mr. Babatunde. It will be from the perspective. So you have had the privilege of working across multiple portfolios, multiple programs. What do you think is the most common reason why a well-funded digital health project fails to transition from a pilot to a national scale in your experience, and how can innovators and organizations like ours mitigate against this?
Okay, thank you. Am I audible? Hello, am I audible?
Yes, please, you can go ahead.
Okay. So most digital health pilots in Nigeria, and I'll be straightforward, right? Most digital health pilots in Nigeria and across the continent, if you may, are usually designed to impress a donor review panel. So more times than not, and especially for health and in the public health sector, development space, they are usually just built around the donor 9 months reporting cycle, and not necessarily the government procurement calendar. Oftentimes, maybe the inventor is able to get audience with one director in the ministry, and usually what you will require, is to work simultaneously across, multiple agencies. So, those are usually what the problems are. And you look at a place like Nigeria, where you have, 36 different states, multiple ministries, all trying to regulate affairs, in that space. So again, like I said, more times than not, what you find with pilots is that they are structured to satisfy a funder's, M&E's period of change or log frame. Not the kind of evidence that the ministry budget director needs to justify a lie. So I will call this the pilot trap. And a lot of times, most of these products are just stuck, the same technologies, usually available, but you've actually had unicorn firms, right? Firms that have grown big and have, succeeded in that same space. So the technologies are often enough. I mean, I won't say excellent, but often, enough. You usually have genuinely brilliant health tech founders, building world-class products or decent products that can thrive. And I would say that the specific problems you probably want to map or want to group into 4. The first, right, is information deficit. So a lot of times, innovators operating in a regulatory fog, not knowing which agency handles which approval, that usually is a big problem. Then you also have the trust deficit, right? You don't have a structured mechanism for innovators to credibly demonstrate readiness, to government. So procurement officers simply cannot act. And also importantly, you have a coordination deficit. No mechanisms, that will organize the multiple agencies an innovator must engage with simultaneously. Somebody to handle, the innovator, around working with the multiple regulators. And lastly, right, there is a sustainability deficit. So most pilots, like I mentioned earlier, what they survive on is passionate relationships that will collapse, when whatever champion you're working with or the donor that you're working with, that relationship ends or that donor exits. So when all four deficits are present simultaneously, and they almost always are, the most technically excellent, best funded, most politically supported pilots will see that, right? So the solution obviously has to be, uh, fixing all the deficits. If you fix one, the other three will kill it anyway. So just working around fixing, these deficits, I think, uh, are the solutions. So it's not necessarily that you need to build a better app, not necessarily about funding. There has to be an engagement in infrastructure. That I think is the missing tissue between innovation and scale up. Thank you.
All right, thank you very much. I mean, as always, problems in health are always multifaceted, and we often almost always need multiple solution layers to solve them. But I'm happy that you give that context. And this just, whistles the need for independence and actually building tools that solve the pain points of our patients so that they have some level of sustainability. So thank you very much for that context. So I'll go back to Dr. Darlington. Again, about artificial intelligence. We see that, in the global south, there are already existing AI frameworks, AI strategies that guide the usage and implementation of artificial intelligence. Coming to Africa, we see that, again, we are several steps behind, thanks to organizations like yours that really putting us on the global map. But we see that most organizations are several steps behind. One, how do we draw the line between trying to catch up and implementing frameworks and strategy that guides the usage of artificial intelligence? Two, in terms of data, we see that most of the tools that we have been trained with data from high-income countries and then fine-tuned locally. How do we solve that problem to ensure that we're able to harness our data to build our tools end to end?
Okay, thank you so much. That's good questions. So I think maybe the starting point I would say is that we wrongly estimate where Africa is when it comes to AI governance framework, right? So I'll give an example. In Ghana, I'm currently serving as the co-lead for the National AI Strategy, working with our Minister of Communication, Honorable Sam George. The original work for the strategy started before I got involved in it. It started in 2022, 2023. I played a part in there, and now I'm co-leading it. So we've been working on a national AI strategy in different forms. There's already a national ethical AI framework in Ghana. In Nigeria, there is also a national AI strategy. It's already been published, right, by the Minister of ICT. If you go to Kenya, if you go to Mauritius was one of the first to do this as far back as like we're talking about 2018, 2019. Mauritius already had a national AI strategy. Kenya had an AI task force. I met the head of it back then. I've forgotten the name now. I think they also published theirs. Tanzania has theirs. Morocco has theirs. So the perception that we aren't doing governance is not necessarily true. Right now, I'll say we probably have about 15 governments across the continent with some AI governance initiatives, right? Then we even have the AU one. So I served as the chair for the AI economy working group, where we created a continental AI strategy. As it stands right now, Africa as a whole has a continental AI strategy. We are ahead of a lot of continents, right? We are ahead of a lot of places. So it's worth acknowledging that government is, even though AI is new, government has actually put in effort to do that. So, for example, even Zambia, we did a presidential delegation that moved from Ghana to Zambia, and I was part of it. We met the president of Zambia. We met their digital ecosystem. One of the key things we were talking about was AI. So the two presidents brought their digital teams together and said, share ideas. What are you doing in Ghana in AI? How do we bring it to Zambia? So government we need to give credit to government. There's actually a lot of effort being put in across the continent, right? It doesn't mean everything is perfect. So one of the things you mentioned is data. I'll also say even for data, a lot, we've come a long way. There used to be an initiative called Lacuna Fund. Lacuna Fund funded the creation of African data sets in healthcare, in agriculture, in language. They did this for about 5 years. Unfortunately, with the new political climate in the US, the project was shut down. But in that period of 5 years, they funded the creation of several data sets. Even from our end, we've created about 3 or 4 data sets across healthcare and agriculture. We created a malaria data set that is in Ghana and Uganda when it comes to being able to use AI to detect malaria via microscopy, right? We've collected several data due to a number of projects we are working. We've partnered with facilities. We've partnered with biolabs, collect data, even collecting large enough bio data that you can use to train AI system. We trained our generative AI system called Moremi AI. We did this, was it 2 or 3 years ago, which supports everything from medical screening, diagnosis, treatment planning, prescription, to even drug design. So being able to design novel drugs using references like herbal medicine or any of those data sources. We've done all of this by leveraging data from Africa and also, of course, collecting data from other places, because essentially we now have our AI system being used in every continent except Antarctica, right? So what I want to say is that there are definitely challenges, but if you dwell too much on the challenges, as an innovator, you have to live with challenges, right? Your task is how do you overcome those challenges? There's no award for being able to list challenges, right? There's no award for that. So you can mention, okay, you are frustrated, everything. We currently work with private sector, we work with government, right? Across multiple countries. Coming from the private sector, working with government, it wasn't easy. It's still not easy. Things move entirely differently, right? You have your timelines, your technology timelines, but then you also have to deal with the minister. The minister has 5 million things on the agenda. Your thing is just one tiny fraction of it, right? So you need to understand that you need to have the liaisons that will facilitate that. There's several things that comes to it, but you need to overcome it. Things are not perfect for us, but every time we come up with challenges, we just have to find a way to overcome it. Be angry and frustrated, which I have been for a while, but then you need to go beyond that. You need to ask yourself, maybe you want to deploy in a country, the biggest challenge might be regulatory challenges. One thing you could do is complain. The other thing you could do is actually engage your regulators. We've worked with African Union and medical regulatory agencies across the continent to create an AI for health specific framework, regulatory framework, which is now part of the harmonization effort. So what medical agents, what medical regulators want to do in Africa now is have a setup that if you are in West Africa and you have your medical solution, your AI solution authorized in Ghana or Nigeria, it covers all of West Africa. You don't have to go through the same thing in different countries. Or we do it, there's the AMA that has been set up in Kigali, the African Medical Agency, right? You go through that and it cuts all that process. So the governance framework is improving. Innovators need to also meet the governance component of it. So you don't sit back and say there's a problem. Go work with regulators to explain to them how what you're doing benefits the country. How could you help? How could you be of service to facilitate that so that it's easier for the next generation that comes after you? So it doesn't take them 5 years to do what you did. It takes them 1 year. But then that's the thing. You have to, as an innovator, the whole point is being able to solve challenges. That is what makes all the difference.
Thank you very much, Darlington. I feel like there's a need to have a separate session with you because there's just so much insight. And I feel like this is so much great information because a lot of people on here do not know that we already have so much AI strategies and frameworks already in place that are being implemented. Because I recently even just heard about the Nigerian framework that has been implemented. And it's so important that we create awareness about this because there's a perception that they do not exist. So people are implementing without them. And we're just talking about the problem. So while in fact, we are several steps ahead. So there's a need for the implementers and then the government organizations building the strategies to sync. And then we come together and then have that handshake where we know where we're supposed to build and then we're building in line with those. So thank you very much, Darlington, for that insight. My next question is for Dr. Obinna. I'm calling everybody Dr. Mr. Obinna. And it is really a very important topic. So when it comes to digital tools and data generation, especially foreign funded digital tools, the big question on the table and has led to, the end of so many beautiful innovation is who owns the data that is generated by these tools. So my question is from the government perspective. One, who owns the data that these digital tools are creating? What are we doing with this data in terms of refining and training tools to learn from those data? But more importantly, how are we able to come up? Are there plans or strategies in place to ensure that with the advent of digital tools and artificial intelligence, data from foreign funded tools remain within Africa and are used by Africans?
Sorry, the question is to...
So, Mr. Innocent, the question was for you. Do I run through that again?
No. I heard it. It's just that you mentioned the name, so I wasn't sure. Thanks very much. So I think in a lot of jurisdictions, and maybe just to also mention that the Africa CDC has been working on a data governance framework that will be like kind of a guideline for a lot of countries. But however, I think speaking from my experience, we take it that the data that is generated by any system should, number one, be able to benefit the patient, and then number two, the government in that country is really responsible to ensure that they are custodians of that data, which is generated by whatever tool. So even if a system or a tool has been brought, in fact, that's one of the things that, like for us, we really ensure that before vetting a system, is that we make sure that those tick boxes or those check boxes are checked. Is that number one, that data belongs to the country. Number two, to the people who are supposed to benefit from that data. So for an electronic health record system, for instance, I as an individual, I'm entitled to my record. But yes, we do know that there are secondary uses of data, and even those secondary uses should be clear in terms of the way that they are spelled out legally, and there should be a benefit to the country if there are other users, or for instance, foreign organizations who would like to have to know something about the country, who would like, and of course, following the necessary rules, but you see, there should be a benefit to the country. But for us, we have a data governance framework, we have a Data Protection Act, and one of the things that the Data Protection Act emphasizes is the data residency. So tools should be locally hosted within our national data center and any other data centers within the country. So that is really what we try to do, and what we try to make sure is to really put data governance at the top. Yeah.
All right, thank you very much. I think a central theme across all speakers has been emphasis on data governance. really because who owns the data is key officially in this time and season, and who owns the data controls the trajectory of development of digital tools. And it's important that we not only create this framework, but we publicize and implement them across Africa. Thank you very much for that. I would move on to Dr. Kemisola. So my question is around underrepresentation of women in digital health, in engineering, and simply innovation. With underrepresentation comes lesser investment in female or women-related diseases, or even innovations that solve problems for women. How do we realistically solve the challenge of underrepresentation of women in the field, but more importantly, clamor for more investments in ideas that are focused on building innovation that solves female problems?
All right, am I audible? Can you hear me?
Yes, please. Yes, please.
Hello? Hello? Can you hear me? Okay, awesome, awesome. Thank you. All right, thank you. So I think the problem here is not even the underrepresentation of women in STEM, because it's a global problem. It's not just pertinent to Africa. I know it's a global problem. We have underrepresentation of women, but now due to numerous advocacy, now we are having more women in the space. Even women transitioning now from whatever field they have, transitioning into STEM. It's the momentum is quite high all over the world, not just Africa. So it's quite encouraging now. We are having more women. But the problem is having a problem-solving women. I think that should be the problem now. There should be main concern, more women in STEM, but not just that alone, more problem-solving women in STEM. Women that can look around and use their skill set to solve a problem within their reach. So I think that is the problem. Women that are research driven, not just women coming into STEM. So I think that's just what we should tackle. It just reminds me of when we were working on doing research on the breast cancer, and we have to interview more women to get their pinpoint. And got to a point where some women told me that it seems, though it's a joke, but that's a reality, that it seems that it was men that designed the mammogram machine, which is the truth. Because assuming it was women that designed or that developed or manufactured the mammogram machine from onset, then they would look at how they can eliminate the pain that we may go through while they're going for their mammogram scanning. So that's the thing. So now we need more women now to come in and solve most of our problem, because men cannot solve our problem the way that we are being affected. We are the one that the problem is affected. So to get a solution to it, I think the solution to come from women that the problem is actually affecting. So that will make me go to the main problem of identify the real problem around us now, to encourage women now, the ones that we have within the STEM space now, the technology engineering space. We need to now encourage them to be a problem-solving person, problem-solving commitment, not just, okay, I want to learn how to do UI, UX, or I want to go into, which is the common one again, and the web development and all of that. No, we need to do more than that. Looking for how you can use a skill set to solve real problem. Then supporting them with research deeply. We need to support women to go into deep research now and build the solutions. I do say something about idea. You can have an idea, but for you to come up with a solution, you need a deep research on that problem to be able to build that solution. Whatever idea you have about it, if you don't research on it, you can't even execute it. So we need more women in that space now that can do more of this research, deep research now, and build a solution that could solve the problem. That now creating an enabling environment for us. That's another thing. We need to be encouraged. We need to have this good ecosystem that accommodates us with what we have. It will not be good for me as a woman to have an idea or probably go into research for years come up with a solution, start developing the solution, and even my environment, my community is not even supporting it one way or the other. I don't have an emblemable environment, to head what them to just, I think you're doing something good. Even well done, it's okay. But we don't have the environment. So we need an enabling environment for this innovation. For those women, this women need to be encouraged, for them to do more. And in this case, I think government institution needs to play the major role. They need to play a major role. We need more investment in research and development. Nigeria, the case study, I know we have a research institute for that. Anything. I can say that all over and all over again. I remember when I'm starting my research, I wrote to so many research institutes, even in cancer, and they were like, "Oh, well, you're doing something good." I think we don't probably have the ability to support you. We can't even be in partner with you. So they throw it on the table. So we need that. Whereas in other
I think we lost Dr. Kemi.
countries, the support that even your dumbest idea.
Else can hear me, so I think we lost her briefly. I'll just move on to Mr. Babatunde, whilst we try to get her back.
Apologies.
So my question, she's back. Go ahead.
I'm sorry, I was cut off by the internet. I'm so sorry. That's one of the problems. Thank you. Please, you can go ahead. We are used to it.
All right, thank you very much. We're definitely used to it. I'm literally at the edge of my seat, just like, hope it's not me. Hope it's... But yeah, thank you very much for that perspective. So my next question would be to Dr. Mr. Babatunde. And it's really around fragmentation. So there's a part of fragmentation of data, and there's a fragmentation of digital health solutions. So everyone is literally doing what they are doing. We have healthcare startup, we have government organizations, we have innovators, we have entrepreneurs. Is there a need for a unified digital health solution provision across board? If yes, how do we realistically make these systems interoperable, but more importantly, unify or implement them into existing national healthcare services?
Okay, thank you. I think you can hear me very well, because we all face the same challenges. Am I audible still?
Yes, you are.
Okay, yeah. So I think the problem you identified is a very real one, especially in the health sector, which we are both familiar with. Many times you have, vertical disease program tools. For instance, at the count of my hand, I know for PEPFAR, there are multiple EMRs. Gavi has its own, and all of these are built in silos, because the programs they serve were funded also in silos. So again, in Nigeria, you have 36 states dramatically at different levels of digital health maturity, right? And there's an action of a single coordinating body, with a mandate and the teeth to enforce standards. So it is a problem as you have described. But here is where I'm not so pessimistic, about interoperability, especially in this country, right? And I hope I don't shock or oppose many people's opinion on this panel, right? So the path to interoperability in Nigeria, and I guess many African countries, is not necessarily with technology. It does begin, with governance, and I mean, specific governance reform. So for Nigeria, there's a need for one accountable entity, not a committee, not a working group, but a single institutional home with a clear mandate and enforcement authority for digital health standards. There is an attempt, to do that already. at least in Nigeria. There's a Nigeria Integrated Data Management Systems, NDHI, which was set up for health systems. And I'll say it's a foundation. And that's why I tell you I'm not so pessimistic. It's a foundation, but the accountability part of that, question is not resolved. And the reason, again, why I think interoperability is achievable is that the federal government of Nigeria, and I've seen this, semblance of this or a version of this in other African countries, there seems to be a genuine political will, right? In Nigeria, you would say through the renewed hope agendas, digital health provisions, and the World Bank's 500 million bridge project, 500 million USD bridge project, right? That is more political and financial capital than we have seen in the last 20 years, right? So there's a window, the window is real, but you can argue that it is not permanent. And I would say that the practical parts, are 3 steps. The first is to establish interoperability standards at the data layer. And I saw that we began to talk about that earlier on, not necessarily at the system layer. You do not need every EMR to be of the same system. You can also use arguments for any other products. You need them to produce data in the same language, and FAR standard is something that you can, easily talk about, or, other established data dictionaries. You need the same framework driving interoperability gains as you have in the US, UK, India. I think it's a very, also very useful example. Then secondly, you need to build government demand for interoperable data. So you reinforce, the use of those, you want to reinforce the standardized requirements. When people actually use the right standards, you want to reinforce that. So for instance, if you want insurance coverage for your products, your system must meet certain data standards or certain standards for interoperability. Create financial incentives for the change behavior, and that I think is one of the fastest way to encourage change. And then thirdly, you want to establish an independent multi-stakeholder technical body, equivalent to, I think, the health tech standard bureau that you have in the UK, something that owns the standard process and is insulated from the political cycle. So in the health sector, for instance, I think FMOH will need to seek some autonomy to this standardized body or this standard body, which I understand that is politically difficult, but nevertheless very possible. So you need to also have, at the topmost top of leadership, somebody that is able to, put a red line down and say that, this needs to happen. But generally, I think there must be, a coordinating body that has the power to actually, make decision. And we've done it before. No matter how difficult you think this is, NCC, it's a body like this. It exists and is working. And you see that that interoperability problem is not a problem that you have in telecom. So it's not as if it's something that has been done before. So I think these 3 things essentially are the way to go. And again, I'm pretty optimistic about our interoperability. Thank you. I hope
Thank you very much.
My network is not the greatest. All right, thanks.
For that, how do we say it? Hope is all we have, and then we have to literally ride on the wings of hope. But be very forceful and with demanding and asking for what we want, and then seeing that we as stakeholders, custodians of health, are able to implement that. So I have a number of questions I wanted us to talk through, but I would want us to move to attend the questions from the audience. I have some that have been sent before the webinar, some also in the chat section. So we'll quickly run through those. We are hoping to be out of here in the next 10, 12 minutes. I know we have very busy people on this call who need to get back to their lives, but this has been so insightful and engaging, and I just love the different perspectives and the angles that this panel have come from, and I hope that's the experience of every other one on this session today. So I'll quickly run through some of the questions that we have for different panelists, and then we'll take it up from there. So I have a question here for Mr. Darlington. And it says for the data sets that you referenced that were funded by Lacuna Fund, I would like to ask how accessible these data sets are to the general public, specifically to young individuals coming into digital health who would like to reference the data to inform pilot ideas.
Yeah, so every data set that was created under the Lacuna Fund initiative is an open access data, even till today, even though the initiative has come to an end. So if you go to lacunafund.org, you will see right now, African collected data sets that are available. I actually just decided to confirm this myself. So I went back to make sure that all the data sets we created are still there. So there's data set for malaria. There's even brain tumor segmentation data set, which was collected in Nigeria. There are about 10 or 15 institutions that are here that were involved in this. There's data for diarrhea, malnutrition, but it's not only Lacuna Fund. If you even go to, let's see, the popular platforms. So if you go to Cargo, if you go to, let's say, Google data sets, and you search African data sets, you find a lot, because there has been a lot of research initiatives on the continent, and a bunch of this research initiative, the data is published under open access. The last thing I'll say, though, is that if you want, as an innovator, if you want to create a solution that is commercially viable, you need some sort of proprietary edge. So open access data is one, but the other thing we did was actually partnering with health facilities. When we started, we basically told a bunch of health facilities, we'll provide you with free access to our AI system for like 5 years. The only requirement is that within those 5 years, you give us health records anonymized, of course, so that we are in compliance with data protection laws. You give us medical images, medical reports, and that paid off. We got a lot of proprietary data that is not publicly available. So as an African innovator now, there's Lacuna Fund, there's other publicly available data, but go a step also in addition, partner with facilities to acquire some proprietary data so that the solution you create then gives you some commercial advantage or moat over competitors.
All right, thank you very much for that question. And I hope it brought clarity to the person who asked that question. More often than not, most of the resources that we are looking for are already available. We just have to search in the right way. So this next question is, so this person is asking, I'm working on a project here, and then I have the AI model. It's built off existing LLMs like Gemini AI. But what it does is just providing a repository of information. It doesn't do the diagnosis or the treatments. How do they ensure that such product or such tool is in accordance with the Data Protection Act, or rather that there are no any form of legal consequences for the implementation of that model? So I will let Darlington speak to it, and I'll also let Mr. Insa speak to this because it comes from both perspectives which you're experiencing.
Yeah, so it's country specific. Africa's data protection laws are quite mature. I think right now we have 20, 30 countries that have data protection laws. They have their annual summit where there's unification across. So a similar framework, right to access, right to deletion, things like that. What I will say pertaining to the specific use case that was given was, it depends. So one, your terms and conditions need to state clearly that this is not a diagnostic tool, right? You need to, so in most countries, for example, it's data protection law, but you also have to look at the medical regulation laws. So there's classes of device. If you're working on AI, the appropriate medical legal term is software as a medical device, or AI as a software as a medical device, which is a new framework that's, yeah. So what you need to do is look at what you are working on. Is it under class 1, class 2, or class 3? Depending on where it is, there are set of requirements. If what you are doing is not diagnostic, it doesn't influence any medical decision. Let's say you frame it as research use only, RUI, or educational use or investigative use only. You need to clearly state that in your terms and conditions. You need to have disclaimers. And when someone asks you to help them diagnose, you can refuse to do that. So you need to do all these things. You need to look at it. Maybe you could bring a lawyer on board to help you look at the specific country you're looking at. How do you comply with data protection law and then the health regulation law? For most of these countries, so for example, yes, for most of them, you also have to go get a certificate from the Data Protection Commission as either a data collector and a data processor. Without doing that, essentially any data you capture is illegal. So you need to also work on that bit too as well. So what you're working on is not wrong. You can proceed with it. Just be very clear in your terms and conditions and your disclaimers that this is not a diagnostic tool. It's only meant to be used for XYZ purposes. And depending on your country's data protection laws, you'll be fine. Probably the last thing I'll say is that let's not forget AI systems now make it very easy. Literally on our AI platform, Moremi AI, I can pick any African country and just tell us that research the data protection laws, the medical health regulation policy, everything for me. Look at the solution I want to work on. I have this new idea. Look at all the compliances that I need to look at and provide a detailed overview for me. It provides this, I read it, and I know what to do. So use AI to help you deploy AI, basically.
Thank you very much for that. That's very interesting. It's like when you want to ask ChatGPT to do something and then you tell it, I want to do this, give me the prompt, I need to give it to you to help me do this. But yeah, I mean, one way or the other, we'll find a solution. But thank you very much for that insight. And I think it's very important because we see a lot of new tools coming up and there's no clearance on the guidance for implementing those tools. So I have a question here for Mr. Innocent. And I would like to know most digital health solutions, especially within Africa, seem to be heavily centered around the issues of immunization and vaccination. From your standpoint, as someone working with the Ministry of Health in your nation, would you say that there are other neglected or overlooked health issues based on available data that you hope or wish will receive more attention?
Yeah, thank you very much. So yes, it is true that that a lot of systems are really based on the funding. I think for a lot of countries it would be like you've said, vaccination, because there's been funding from Gavi, UNICEF, etc., to provide vaccines to children and so on. And then for those countries that were PEPFAR focused countries, it is really the area of HIV that was heavy, including ours. Though we started out our electronic health record system with the antenatal piece, then moved on to HIV. But you see, I think building a platform, you should always have that in mind, that this platform should be able to evolve as time goes on, and that's the mentality that we had when we're building even our very, very first platform, is saying that we should be able to build other disease areas on this platform instead of it remaining an HIV or antenatal platform. So yes, there are a lot of neglected areas in the health sector, but I think it's important for the government to take a central role in the governance of digital health solutions, as opposed to just being a consumer of those digital tools. So for us currently, the central government, and I think maybe aligning to what Dr. Darlington said earlier, our government has really put digital at a premium and created what is called the Electronic Government Division, which is like a higher body above government ministries that is in charge of digital transformation. And so one of the things that we have done, what has happened in the past few years, is that the Electronic Government Division has invested in the electronic health record system. Before, it was all donor funded, but now central government has decided to invest in there and get ownership. And as a result, we are expanding beyond just the areas that we talk about, whether it's HIV, whether it's TB, whether it's malaria, going to all the other areas so that it can be applied. Because, we are resource constrained in our country, resource constrained as well as our numbers. We're only about 21 million. And so we don't have multiple systems for multiple things. We decided, look, we're going to do one electronic health record system for the public sector because of course, resources. And so that's how we're going and trying to develop that and make it a richer source of data, a richer system that can be used at public health facilities and those private facilities that are willing to buy into it. Thank you.
All right, thank you very much, Saf, for that. I'm really glad you're able to give a very contextualized response to that, and I hope this was helpful to the person who asked this question. So one more question for Mr. Babatunde and Dr. Kemi, and we'll wrap up. So for Mr. Babatunde, this person is asking that for a health tech company that is new in the health tech space and have new products that are just coming into the Nigerian and African market, how can they survive in the Nigerian market? And what are the things they should do to keep them or to help them to ride against challenges in health tech? How do you advise, really just support for a new organization coming into the Nigerian health tech space, how they're able to, glide above challenges? And this person is also asking if you're open to mentorship and the best way to get across to you.
All right, thank you. Thank you very much. So, and I think this also is affected, or this also is very related to some of those things that I talked about, how do you survive? And I think the most important thing really is to first understand, the landscape of the, whatever part of health that you are building products for. So, you must be sure that the products that you are building, right, actually are real problems and not just things that are most easy for you or convenient for you to build, or things that you probably have seen that have worked somewhere. If you walk into any primary healthcare center in Nigeria right now, I think it is not going to take time before the real problems stare you in the face. And a lot of times, this might not necessarily be the products that most people are building, right? They might not be very flashy. Things as simple as, just payment system. Sometimes people have to walk around, different places. Things that you can easily, even by yourself, point out to other systems that have worked in, other clients. The other thing I think is also very important is to understand, the regulatory bodies that govern that area of work. If you work in primary healthcare center, for instance, you understand that NCDA has to be involved in that. For some products, you have to involve NAFTA, the FMO, that. So complexity of the regulatory agencies that are involved in that. The other deficits that I talked about, necessarily might not be within your purview. And I will say that at AHFID is one of the things that we've been working with government to ensure that there's a central engagement platform, that innovators can talk to, to provide that kind of hand-holding, even this understanding of, the regulators and the regulations, to have a platform that you can engage to do that. But essentially, I think I would say the first thing is to ensure that you are building products that are really needed and, and understanding the complexities, of that disease area. In terms of mentorship, so one of the other things that we also do at AHFID is we have cohorts of people that will train innovators, inventors like this person possibly, that we take through the weeks program navigate, this space, this innovation space, build your products from design, to making it sustainable. So that is always out. You can contact Joy, or you can always reach out to us, and there's provision for mentorship. Thank you.
All right, thank you very much for that. And we'll take the last question for Dr. Kemi. And it says, given our limiting environment, in what practical ways do you think early career researchers, especially women, can get ahead in AI for health research?
All right, that's an amazing question. I mean, that's part of why I'm here to sensitize women. Is part of the advocacy for the inclusion of women in STEM. So I think the first thing is to identify the problem that you want to solve. It's very important. You know what exactly you want to solve. For instance, maybe you look around based on my own style of research, or based on my own style of innovation. I actually develop solutions to problems around immediate problems around me. I mean, that actually helped me a lot to, give me like an element to what I'm doing. So the person is for you to identify the exact problem that you want to solve. Know the problem very well, not just knowing it, ask questions, use different means of collecting information from the people that this problem is affecting. You need to know certain issues, but that will assist you with your research, and that will also assist you with whatever solution that you're coming with. Secondly is building a team, because you can't do it alone. I'm a solo founder as an entrepreneur, and it's really really hard. I have a team, but as a solo founder, it's a big tedious for me to make some, progress. So you need to build up a team. Aside your technical team and all of that, you need people that can work with you at whatever level that you're working on. You need a team to do this work based on your research and the sector that you're working on. So that also these people, because we have different diverse of idea, diverse of brain. What I know, this was my number to bring all the things together and the it comes together to come to a solution. So another thing is the AI no come up with a solution. But what I said that AI in health. So that means that an hardware solution. We have so many platforms like what Mr. Darlington have already said. Platform like his own now is already there for us to utilize, where you can fetch data. They have data in some of these areas, which is awesomely good. I remember when we were working on, still trying to fetch data in Nigeria. It's a bit difficult. It's also difficult. Anyone went to hospitals with our license to get data, records. So it was so difficult. We have to go onto the internet and fetch the data that we saw on the internet. And at the end of the day, we had so many bodies because the result don't know post them, and we are using it to trade the problem that is that has been affecting Black women, and we are getting the data on the internet probably owned by white women. So there was so biased. I think we have people that solve those problems for us that's already solving it, like Mr. Darlington said, we can use those leverage on those platforms to fetch data that we can use to train our AI. Then another thing is regulatory compliance. That's another problem. It's my, I don't have not encountered that in Nigeria, maybe because we've not got to that stage in our development, because Nigeria is not our first deployment country. So, but I don't know how the regulatory works. So I think that's another thing to look into, how to discuss with them at early enough, so I don't have issues with the regulatory by the time we get to that stage. So I don't know, maybe your AI helps us commercialization or just want to develop, so that depends on you. And another thing, if you are commercializing those products, very important, be you a software solution provider and whatever, an entrepreneur, that way, you need to know your customers. You have to go out there, know the people you want to target, know what they want, know what they need before you start anything at all. So many startups have failed because they just pick a problem. Okay, I have an idea to solve it. They started building the solution without knowing the customer that will be buying this product. So many entrepreneurs, so many innovators have failed. So it's another thing for you. If you're going out to commercialize your product, to scale it up, then you need to know your customer. So thank you so much.
Thank you so much for that, Dr. Kemi. We need solving problems, providing solutions for problems that do not exist. We had one question that just came in now, so we'll take that and we'll wrap up. This is the last question that we'll have to take because of time. And this is from Mr. Darlington, and it says that you mentioned that you had transitioned from the private sector to working with the government around strategies, policies, and all of that. Could you give specific examples of hurdles you've had to encounter and how you've able to navigate, of what you have learned from that and managing such situations more effectively?
Oh, so I mean, one of the things I've had to learn, and I'm still trying to learn, is diplomacy. I'm terrible at diplomacy, which is not the best attribute when you are engaging with governments. But so, I mean, there are a number of hurdles, right? One of them is understanding incentive matters. For governments, they have access to the full set of distribution. So they are in charge of managing the entire public health on the entire nation. So if you come to them and you say AI is something they need to prioritize, there need to be a justification, there need to be an incentive. Because just know that as you're coming to them talking about AI, there's another group telling government, no, blockchain is the future and present. There's another group saying it's nanotechnology, it's biotechnology. So there needs to be a clear incentive. So for governments, for politicians, because a lot of government is made up of politicians, there needs to be a clear drive of what is the national goals. If the president's goal is that he wants to be able to reduce, let's say, maternal and neonatal death rates, right? If that's part of the national ambition or the Ministry of Health's goal, go and make a case for why AI can help drastically reduce the death rates at a lower cost than the present solution. You need to make those incentives clear. So those are some of the things that we had to learn, because initially the mistake was we were speaking to private sector actors. And so once you switch and realize that no, it's not private sector actors, this is government, there needs to be a clear political justification of why this needs to be done, then you create that incentive. But of course, it can also be FDI, so foreign direct investment. You can make it clear. So one of the things when we're doing our presentation for the National AI Strategy, I mentioned the fact that what is Ghana's GDP? It's like, I don't remember now, I think it's 80 billion or something. And at the time, I made it clear that OpenAI was valued at $300 billion. As of today, it's being valued at over 850 billion. So if a single company leveraging AI can create a valuation larger than the entire GDP of a country, it makes it clear that AI has massive financial return. So we made a case and said that we did a calculation, came to a conclusion that if Ghana aggressively adopts AI at the national level, we could add up to $20 billion to the national GDP. So that created an incentive of saying, okay, if within my term as president, as minister, as director of some agency, I can put in these measures that is growing the GDP, reducing mortality rates, medical disease prevalence, and all of that, I leave a legacy and I make a clear point that we were very effective government. So always go back to the incentive. It's different incentive for government. The motivation for government is not the same as the motivation for private actors.
Thank you very much. That was such an amazing way to wrap this up. And we're very grateful again to all of our panelists. This has been such an amazing session and been so insightful and educational. We are grateful to everyone who has joined and has been, sat throughout this entire conversation. Thank you very much, Mr. Darlington. Thank you so much, Dr. Kemi. Thank you, Mr. Emerson. Thank you, Mr. Babatunde. You have been an amazing, amazing panel. I couldn't have done this with a better panel. I have learned so much, and I hope that this is the experience of every other person that has been on this panel. To Sydani Group, thank you so much for organizing this. Again, the goal for us on this is not just to have a conversation, but for this to be a springboard of collaborations, partnerships, but more importantly, key stakeholders like ourselves coming together to partner to push for better digital health representation, better strategies, better implementation, but more importantly, ensuring that the digital tools that we are creating and implementing are solving the pain point of people around Africa. So thank you very much, everyone, for joining. Thank you once again to our panel. We will be sending out an email after this and will include LinkedIn pages of our speakers for people who want to connect and engage with them. But it has been such a pleasure to host this webinar. It's been such a pleasure to host these amazing personnel. Thank you so much for your time investment, your intellectual investment, and we are looking forward to not just collaborating with all of the panelists, but all of the audiences that are here. We would, like I said at the start of this is the first of so many other digital health webinars that will be coming from Sydani Group. And the goal for us is to continue to push the message of digital health implementation, talk more about the projects that we are currently working on, but more importantly, form a community and network of digital stakeholders. So thank you very much. Once again, my name is Dr. Joy Ifowokan, and it has been my utmost privilege hosting this digital health webinar. Until next time, do have a great morning, afternoon, evening, and wherever you're joining from. Thanks, everyone.
Thank you.
Bye, everyone.